Good day and welcome to Kalusugan ay Karapatan. I am LILIAN de las Llagas, one of your hosts today. Dr. Menchit Padilla is also with us as my co-host.
Good day to our viewers. Dr. Lily, our topic today is very interesting and timely. Just several months ago, the death of a woman who underwent cosmetic surgery hugged the headlines of the broadcast media, and social media's posts were abuzz with this news.
Yes, Dr. Menchit, and this makes me wonder whether the patient knew beforehand the unintended consequence of this procedure. Well, today's Kalusugan ay Karapatan episode, therefore, is very timely as it tackles one of the most popular, demanding procedures, not only for women, but men as well, beauty or wellness. Our program aims to inform our viewers who are interested to undertake such procedures and the corresponding benefits and risks of cosmetic surgery. As far as I know, the benefits of cosmetic surgery are seen both physically and emotionally. Cosmetic surgery will not only make you look and feel younger, thinner, and prettier, but it will likewise boost your self-esteem. Those who underwent a successful cosmetic surgery have become more outgoing, more personable, and more confident.
I agree with that, Dr. Lily. Cosmetic surgery, procedures like liposuction, butt and breast enhancement can greatly enhance one's life. People who have had these procedures find themselves more physically active and much healthier. And individuals who undergo cosmetic surgery find themselves emotionally more confident. I observe that patients who are no longer self-conscious about their physical being, and they can focus living their life instead of worrying about the way others are looking at them.
Yes, these plastic or cosmetic surgeries are so popular today because these indeed improve the physical appearance of a patient. I am wondering why people go through these procedures. I understand that there are many perils in undergoing cosmetic surgery.
Well, like any medical procedure, there is some degree of danger in doing this surgery. Complications occur despite modern procedures because these complications are enhanced during the surgery due to certain health conditions, such as diabetes, hypertension, and other conditions. In such a case, how should the patient know? How do we get this information like the risk?
We will answer this later, including questions about consequences, if there are any, about the procedures. Maybe there are certain standards set by the government, so cosmetic surgeons should be competent and possess the medical skill and knowledge required in the field or specialty. They have the duty to exercise reasonable care, skills, and diligence as physicians.
You're right, Dr. Lily. Therefore, in order to prevent this risk, it is a must that you choose an expert, an experienced plastic surgeon, or dermatologist who has a proven track record of success with minimal complications. And of course, the patient should know who these experts are. There should be access to a database which the patients can avail of so that they can choose the legitimate surgeons who will take care of them.
But Dr. Menchit, I am confused because I also hear the words plastic surgery, restorative surgery, reconstructive surgery, cosmetic surgery. How different are these from cosmetic surgery? Let us then ask our invited special guest today to tell us more about the differences between and among the terms, as well as the latest procedures and technologies to ensure the safety of patients when the procedures are performed on them.
Yes, let us listen to authorities on this. May I now introduce our guest today, a very good friend of mine, as well as Dr. Lily, a top-notch cosmetic surgeon, expert in plastic and reconstructive surgery, Dr. Jose Joven CRUZ, JJ to us, to tell us more about this topic today. So welcome, Dr. JJ.
Welcome. Good day, Dr. Lily and Dr. Menchit, and to our viewers. It is an honor to be here, and hopefully we can shed light on your questions that you posed just a few minutes ago.
Let me start, Dr. JJ. How do you define and differentiate plastic, cosmetic, and reconstructive or restorative surgery?
Plastic surgery is the general term for all types of reconstructive and cosmetic surgery. So plastic surgery has two major branches. One is reconstructive surgery and the other one is cosmetic surgery. Reconstructive surgery or restorative surgery deals with those patients who have problems or who have defects at the outset. Whereas cosmetic surgery, we would deal more with patients who are normal. They don't have any defects. It's just that they want to enhance or to beautify themselves for their own self-esteem.
So I'm just curious, Dr. JJ. So when you talk about they want to enhance their personal being, is there a particular age group that actually seeks your advice on this matter?
For cosmetic surgery, it is a standard for us to do cosmetic surgery only on those who are at the age of consent, which is about 18 or more, the age of 18 or more. Because at this time, pretty much the body, the face, and maybe the breast or the butt have reached their adult size, adult proportion. So we don't want to perform any cosmetic procedures on those who are less than 18. So that's the practice that we espouse to our patients.
So I just want to ask, what are the most common cosmetic surgeries that are requested by our patients?
In the Philippines, the #1 cosmetic surgery procedure is called blepharoplasty. It is surgery to enhance the periorbital area or around the eyes. This is pretty much where we remove the hooding skin or the eye bags underneath your eyes. That's the #1 request that we get from our patients. #2 would be surgeries of the nose, rhinoplasties. #3 would be breasts and body enhancements like tummy tucks and liposuction. Those are the top procedures that are requested by our patients.
I mean, the eye. So, I mean, what age are these patients? I'm just curious now, are these young patients or middle age or old patients?
For the blepharoplasty or surgery around the eyes, we usually get those who are in the 50+ years age group. The reason for this is that this is the time when the drooping of the eyes happen, and our patients would come to us and they would tell us, "Doctor, when we take our picture, we look tired." Or patients or our friends would tell us that, were you able to sleep well last night? So they would request some enhancement around the eyes. So we would get them at around that age. Those who are younger would be those who would have a strong Oriental origin or a strong maybe Chinese origin, where they would have to want another fold in their eyes. If you note the North Asians, or those who have Chinese, Japanese, Korean descent, they don't have an extra eye fold. And their eyes would usually look a little smaller than usual. And they would come to us, they would tell us to make their eyes look bigger. And these are the younger patients. These are patients who would come in when they're in college, maybe when they're 20 or 20 to 24, 25, and they would request to have another eye fold. And when we perform that, then their eyes would look bigger, not the chinky eye that sometimes they do not like. Yeah.
So, Dr. JJ, is this procedure permanent?
Well, we do not say it's permanent. The standard thing that we say when we do a blepharoplasty or surgery around the eyes, that for the middle age group or the older age group, we tell them that this procedure would probably last you about 10 to 15 years.
10 to 15 years.
And you may need another procedure after 10 to 15 years. For the younger age group, then it is more permanent. When we create another eye fold, and when their eyes would look a little bigger, it is a little more permanent than when we do it if they're a little older.
So in terms of cost, is it expensive?
There is a cost to it. It would depend on where you would have the procedures done. It would be a little cheaper when we do it in the clinics. Of course, a little more expensive when we do it in the hospitals. But overall, we need to look at a facility in which this facility has been licensed by the DOH. The DOH, the Department of Health, has a criteria or a checklist wherein it has to be fulfilled by the hospital or the clinic where this procedure has to be are performed. And once the checklist has been fulfilled and the requirements are fulfilled, then they're given a license to operate.
Dr. Jeja, I'm interested in the rhinoplasty. Can you describe this to our viewers?
If you look at the Filipinos, no, our roots are pretty much the Malay race. And the Malay race would have a flat dorsum, the nose. They call this is the dorsum of the nose, and a broad base. So the #1 request that we get would be a dorsal augmentation. Or in Tagalog, gusto nila magpatangos ng ilong. So we would put an implant just about in this area so that their noses would be a little higher, a little more matangos. We blame this on Western media because all these movie stars, all these actresses, actors are portrayed with tall noses. So that's why our countrymen would also want to have a nose just like their idols.
I have a question. Is it permanent?
Yes. When we put an implant, it is permanent. Okay. There are several types of implants that we can put. It can be a silicone implant or another type of implant which we call Gore-Tex. The gold standard in implants is that we get a piece of tissue from your own body. So we can get it from the cartilage of the ear, the hard part of the ear. We can harvest that and put that underneath the nose. And that would bump up or make a new nose up here. Or we can get it from your ribs. But those who do not want to have those taken from their bodies, then we can offer the silicone implant or the Gore-Tex implant.
Which is cheaper?
It's cheaper to have the silicone implant because it has been used for almost how many decades already. The Gore-Tex implant is a little more expensive because it has just been introduced into the market.
Yung third question, Dr. Lily, let's talk about breast augmentation.
All right, breast augmentation is one of the more popular plastic surgery or cosmetic surgery procedures that we have. Again, being Filipinos, I don't know if it's a blessing or a curse that our women are blessed with smaller breasts compared to our Caucasian counterparts. So again, blame it on Western media. Of course, the sexy women are portrayed as having big breasts. And in that case, when we get requests for augmentation of the breast, then we offer them, again, these silicone gel implants. These implants are silicone gel wrapped in a silicone wrap. No, implants now are very safe. These silicone gel implants are very safe. And usually we make small incisions just underneath the breast to insert these implants. It is a procedure which should last about 1.5 hours, but we do it under general anesthesia. And we usually ask our patients to stay a few hours after the procedure, or if not overnight, before we discharge them.
Is it also permanent?
It is permanent. The implants now are permanent, and a lot of new technology has been poured into manufacture of these implants. As such, the implants from the late 70s when they were developed are a lot more inferior than the implants now. So the implants now are permanent.
So I have a question, Dr. Lily, and
Yes,
I'm
Dr.
sure this is also the question of the viewers. How do you choose your surgeon? Because when I pass through all this in the road, you can see this advertisement, cosmetic surgery available here, and I look at the clinic; it's a small clinic. That's my first, and then second, I have seen some cases wherein the nose droop, yung parang yung kanyang hindi nag-work yung implant niya, and I've seen some people na drooping. So my question really now is, how do we guide our viewers in choosing the right doctor?
Okay. Of course, if you're a patient, you need to do your assignment. The first thing that you have to look at is yourself, meaning, are you fit to undergo the procedure? Your doctor will tell you that, will ask you questions, will request some tests. Another one for the patient would be, are my expectations, if I am a patient, are my expectations doable or reasonable enough for the doctor or the plastic surgeon to be able to fulfill them? Okay, so those are the things. For the doctor, understand that plastic surgery is a very specialized field of surgery in itself. To train in plastic surgery, after internship, after medical school and after internship, you have to train for 6 to 8 more years. It's just like repeating medical school all over again. After finishing the training, the plastic surgeon has to pass a certifying exam, which is given by, there's a Philippine Board of Plastic Surgery. It usually gives the certifying exams once a year. It's made up of a written and an oral part. Once you pass that, then you are a certified plastic surgeon. It is not bad for the patient. In fact, the doctor will welcome it if you ask your doctor whether he is or she is a board-certified plastic surgeon. Usually, you can check the website of the Philippine College of Surgeons or the Philippine Association of Plastic, Reconstructive, and Aesthetic Surgeons, or PAPRAS. These two websites will give you the names of board-certified plastic surgeons. So that's an important thing. We need to tell our viewers that you need to do your assignment. Look at the facility where the procedure will be performed, and look at the credentials of your doctor who will perform the procedure on you.
In your years of practice, Dr. JJ, years meaning 15 years?
I've been in practice for 17 years now.
17 years. So who primarily seek your specialization?
The vast majority of our patients would be women in the middle age group. Okay. And as I've mentioned, because they would seek usually rejuvenation around the eyes.
Wala na tayo doon. Middle age, Dr. Lily. When you say
No.
middle age, what range
All
are
right.
you talking about?
The middle age, I still classify those who are 50 to 60 as middle age.
Yeah, I am middle age.
So those are but recently we have been experiencing or observing that men would also come in. Men who would request some rejuvenation. And usually still for men it would still be a rejuvenation around the eyes or surgery around the eyes, which they would request.
You know, we were talking earlier about the readiness of the patient. And, how do you pick up the problematic cases, Dr. JJ?
Okay. With our years of training and experience, we usually can detect which patients are what we call red flags, or those patients who we feel will not be satisfied whatever procedure we perform on them. Okay. The first thing that we look at is that we ask them their expectations. What do you expect after undergoing plastic surgery? What do you expect? If we feel that their expectations are reasonable and that the doctor can meet those expectations, then we can perform the procedure on this patient. But there are patients who come in, and a perfect example would be someone who would be carrying a magazine when he comes to your office or your clinic and telling you, Dr. Cruz, I want to look like, let's say, Johnny Depp. He wants to look like a Caucasian actor when in fact he's a Filipino with a heavy Malay features, then you know that his expectations are not reasonable. So those are the small clues and the small hints that we look for before we accept these patients as fit to undergo these procedures.
So if you think they're not ready for it, that's you refer them to another specialist for evaluation, or do you just refuse and say that they're not ready?
Since cosmetic procedures are not emergency procedures, it is well within the right of a plastic surgeon to refuse this patient. If we feel that, for example, the problem with the patient is correctable, meaning there is a physical problem, for example, hypertension or diabetes, which can be corrected, then we refer them to the necessary specialist. But if it is a psychiatric concern, and we feel that it is not immediately remediable or correctable, then I would refer these patients to a psychiatrist. And if the patient comes back to me still without the psychiatrist's recommendation or another specialist's recommendation, then I would inform the patient, I'm sorry, but I cannot perform the procedure on you unless you fulfill our requirements.
So this is very enlightening, Dr. JJ, for me, but I know that there are issues or problems experienced by some patients who have undergone these procedures, like the lady who died after undergoing several procedures on her body. Can you explain this?
Okay, as I've mentioned earlier, there are 4 pillars of safety when you undergo any form of surgical procedure. The first I have already discussed. This is the patient factor. We look at the physical and the mental health of the patient. Number 2 is the physician factors. We look at the credentials of the physician. Number 3 is the facility. You need to know and you need to check whether this facility is a DOH or a Department of Health accredited facility. If this is a DOH accredited facility, then we know that it has been checked by the DOH, the requirements have been fulfilled, and then it is safe to undergo that procedure in that facility. The last, which I think would be applicable to the patient that you mentioned, Dr. Lily, is that the procedure. All right, we have to match the type of procedure to the facility, to the doctor, and to the patient in particular. For example, as I've heard from news items, the patient underwent multiple procedures. And this patient went to a clinic and the procedure was performed in a clinic. Personally, it is my opinion that if I would have to do multiple procedures on a patient and the type of anesthesia would be general anesthesia, I would recommend doing this in a hospital setting. The hospital setting is always safe because you have all the specialists around when you need them. You have all the equipment around when you need them. You have ICUs, you have monitors and all these things. And once it is, of course, it is a bigger facility compared to a clinic. So I think that given those reasons, for multiple procedures, which are big procedures, and the anesthesia is general anesthesia, I would recommend doing this procedure in a hospital setting.
Okay, so Dr. JJ, I mean, all surgeries have risk.
Yes.
And what you're telling us is that it's an elective surgery.
Yes.
And there should be no problems.
Yes.
And so long as you look at the 4 pillars for safety,
Yes.
then there should be no worry on the part of the patient.
Yes, there is no reasonable expectation that something will go wrong. All right. But, of course, we are just human, and then there are, of course, unforeseen circumstances. But usually, when you look at the 4 pillars and you fulfill all the 4 pillars, then the unforeseen circumstances will be held to a minimum. We're not saying that nothing will go wrong. There is definitely a risk for any procedure that a patient will undergo, but if you follow the 4 pillars, those risks are greatly minimized.
So, what are the safeguards that are available for the patients to resort to, Dr. JJ?
Well, the first thing that they have to check, as I've mentioned, aside from the 4, is that number 1, look at yourself. Are your expectations reasonable? Are you fit? Are you healthy enough to undergo this procedure? Number 2, is your doctor credentialed? Is he board certified? Did he undergo the necessary and the recommended training before he performs this procedure? Number 3, is the facility Department of Health accredited? Is the facility a safe facility? And of course, it's always safe to have it in a hospital, but sometimes because of cost concerns, it is always cheaper to do them in a clinic. But again, look at the clinic's license. Is there a license for them to operate given by the Department of Health? And number 4, procedures. If you're undergoing multiple procedures and that these procedures are done under general anesthesia, I suggest you do them in a hospital setting. I think the cost, a little more cost, is much worth it rather than risk danger to your life.
Dr. JJ, it seems like it's a cost issue.
Yes.
So do we get requests from maybe low, middle, and middle class patients like up-pgh? Do
Yes.
we have a number of patients who come in also for cosmetic surgery?
Yes. At the Philippine General Hospital, we are cognizant that there are patients who would request plastic surgery more for the betterment of their lives. For example, if they want to have a career in sales and they're facing people every time, they need to be a little bit more presentable. And we recognize those. So at the PGH, we offer these services at very minimal cost. Of course, there are costs, since this is these are cosmetic procedures, but the costs are greatly minimized as long as we do it in the PGH. We offer them at our office at the Division of Plastic Surgery. The patients can just go there. There is someone there to evaluate them from 8 a.m. to 5 p.m. So we can help them.
Dr. JJ, we've talked a lot about cosmetic surgery, and I think we have to explain to the viewers that plastic surgeons do not only do cosmetic surgery or enhancements,
Yes.
but we have the restorative surgery.
Yes.
So maybe you can also enlighten us on how different it is from cosmetic surgery.
Okay. Actually, restorative or reconstructive surgery is the cornerstone of cosmetic surgery. For a plastic surgeon to do good cosmetic surgery, he needs to have a good grasp of reconstructive surgery. At least at all these public hospitals, we get a lot of patients who are involved in accidents, who get burned, those patients born with clefts. These are all the patients that we handle on a daily basis for reconstructive surgery. So it is a major part of our practice. In fact, when you look at our data at the Philippine General Hospital, about 90% of our patients are reconstructive patients, ranging from patients with clefts, patients who were involved in accidents or motor vehicle crashes, patients who got burned. We see them on a daily basis.
So there's hope,
Of course.
for any patient who has an accident or gets burned.
Yes.
You're saying that we do have plastic surgeons trained
Yes.
to do the reconstruction.
Yes. The important thing is training in plastic surgery, the first thing they need to do is to be good in reconstructive surgery before they can be better in cosmetic surgery. So that's the dictum that we follow. We train our trainees or our residents first in reconstructive surgery before they go into cosmetic surgery.
So, Dr. JJ, we talked a lot about cosmetic surgery, but can you also enlighten the viewers about reconstructive surgery? Is this part of the scope of plastic surgery?
Yes, reconstructive surgery, in fact, is a very big part of plastic surgery. At the Philippine General Hospital, at least, 90 to 95% of our patients are reconstructive surgery patients, meaning these patients come in with defects or problems already. Unlike cosmetic surgery, when they come in for enhancement, they are normal. These patients come in with diagnosis of burns, diagnosis of cleft lips. So they come in with problems already, and they are correctable in plastic surgery. It is important to understand that the cornerstone of being a good cosmetic surgeon is you have a very good grasp of reconstructive surgery, because that will form the basis of cosmetic surgery that you will eventually do in the future.
So we're saying now that there's hope for patients who have been part of accidents, for those who have been burn victims. The plastic surgeon comes in to ensure that we reconstruct whatever has been damaged by the accident.
Yes. We do a lot of these cases. Patients with gunshot wounds, patients who were hacked, patients who were involved in motor vehicular crashes, burns, cleft of the lips or the palate, clefts of the face. Patients who underwent extirpative, or what we call procedures in which they remove one breast because of cancer, we can now make a new breast out of their own tissues. So that is the scope, that is how wide the scope of plastic surgery is. And again, as I've mentioned, we start from reconstructive surgery. The benchmark of a good cosmetic surgeon is that he is an excellent reconstructive surgeon.
Reconstructive surgeon. So, Dr. JJ, are you a cosmetic surgeon or a plastic surgeon?
I am a plastic surgeon, meaning I can perform both reconstructive and cosmetic surgeries.
I have another question. I'm a geneticist, and I deal with a lot of patients with, who are born with severe defects. And I know that the plastic surgeon is actually part of the team. Yes. So can you maybe explain to our viewers, because we do have a lot of patients with multiple problems, and that we need a plastic surgeon from the very beginning, from the very start of the management.
Yes. We do get a lot of referrals from the geneticists, such as you, Dr. Menchit. Again, these patients are born with the defects, number one, of maybe the face, maybe the hands, maybe the arms, maybe the lower extremities. So once we get these referrals, and as long as they are cleared by the pediatrician, then we can perform these procedures. And some of these procedures are life-saving. For example, the patient is born with a severe cleft of the face. The patient is unable to suck or feed. So these patients will not be able to live long. So we need to correct the area of the face in order for these patients to be able to feed. So those are just the things that we do aside from cosmetic surgery.
You know, as a practicing clinical geneticist, I always emphasize to the patients that we create the team at the very beginning, and not to be worried about referring to so many specialists, because they have to be involved in the team. So in those cases with multiple problems of the face, these are congenital defects, aside from the plastic surgeon, who else usually gets involved in the team?
It is good that at least in the University of the Philippines, we have a congenital defect team. Part of the team would be the geneticist. We would also have the pediatrician, of course, the plastic surgeon. We have an anesthesiologist. We have the social workers. We have the psychologist. All these individuals are involved in caring for patients with genetic concerns or genetic problems.
And actually, in my case, I get the neurosurgeon involved because usually I've got defects of the skull. So all of this actually is part of the scope of work of a plastic surgeon. Is there any part that we have overlooked, like we've got cosmetic, restorative, both accident and congenital? Is there any other aspect of plastic surgery that we have not covered?
I guess the one that we have just barely touched would be those with cancers. Unfortunately, these cancers have to be removed, and when they are removed, these patients are left either with a gaping hole, a missing breast, or other missing parts of their bodies. Then it is also the time for the plastic surgeon to come in to restore the defects that were once cancers, now removed. It is time for the plastic surgeon to reconstruct and restore the body part that was removed. So that is one important thing that a plastic surgeon also does, is reconstructive surgery after cancer surgery.
So, Dr. JJ, Many people would be interested to know, if I enter a beauty salon, a cosmetologist cannot do what to me?
Well, we've seen a lot of problems with non-doctors injecting a lot of things into patients. Okay. First thing is that these practitioners or these cosmetologists who are not doctors cannot inject. They cannot do anything aside maybe from massage your face. That's about it. When they inject, that already constitutes an illegal practice of medicine. And they are liable under our current constitution. They are liable for illegal practice of medicine. And that carries some jail time and a fine. So if you have knowledge of these practitioners who are not doctors, injecting, cutting, incising on your skin, then you need to report them to the police. In fact, the PRC will not, or the Professional Regulations Commission will not even touch them because they are not professionals. So this is a police matter, in fact. When you have these unscrupulous people doing this for just to earn a few pesos.
So for the safety of the patient who is running after these illegal practitioners, somebody consciously making sure that these practitioners are actually out of practice at this point?
What the Philippine College of Surgeons and the PAPRAS, or our society, the Plastic Surgery Society, are doing is just to inform our viewers, inform our public, and this is one good fora to inform our public that you need to go to a board-certified plastic or cosmetic surgeon if you want some enhancements done on your body or your face.
So, Dr. JJ, I want lip enhancement. I want, the lips of, who is that popular actress in Hollywood? Will I see you or Angelina lips? Will I see you or will I see a cosmetologist or will I see a dermatologist? Who is the right person to fix my lips?
In cases of those enhancements, which would probably just involve injections, you can go either to a dermatologist or a plastic surgeon. A dermatologist should also be like how you do your homework for plastic surgeons. You can also do your homework for dermatologists. They're also board-certified dermatologists, and they should be able to help you. But when it comes to cutting, incising, putting in an implant, then that's the realm of the plastic surgeon. But injecting botulinum toxins or injecting fillers, then those procedures, which we call minimally invasive procedures, can also be performed by a dermatologist.
So how many plastic surgeons do we have in the country, Dr. JJ?
Right now, there are only 100 board-certified plastic surgeons. Only 100. They are mostly in the big urban centers. Yes.
So, Dr. JJ, you were saying that in PGH, 90% are reconstructive surgeries and only 10% are cosmetic. Is it the same in the private setting?
It is a lot different in the private setting. In PGH, more than 90% of our patients are reconstructive patients, and only a small percentage would be cosmetic patients. In the private setting, it would be at least 50-50, meaning half would be reconstructive and half would be cosmetic. So that's how different it is in the private setting.
But I'm glad that the Philippine General Hospital is able to provide this service to these patients, because what we're saying is that if you don't have the funds but you really want to improve your physical appearance, there's an opportunity for you to actually go to the PGH.
Yes. In the PGH, we perform roughly 1,500 plastic surgery procedures a year. So that's how much patients, how much work we do there. And we see over 2,500 patients a year.
So, Dr. JJ, your last words.
Okay, the very important last words for our viewers. There are 4 pillars in safety in plastic surgery. Number 1, know yourself as the patient. Make sure that you are fit to undergo plastic surgery procedure. Number 2, look at the credentials, research the credentials of your doctor. He should be board certified in plastic surgery. It is not bad to ask, and it is not, and we encourage you to ask your doctors. Number 3, look at the facility. Is the facility licensed by the Department of Health to perform these procedures? If yes, then it is a safe facility. And lastly, the procedure. If you think your procedures would be multiple, meaning more than one, and that these are big procedures and you'll be done, and the procedure will be done under general anesthesia, then these procedures are better done in a hospital setting rather than a clinic setting. As far as you fulfill those 4 pillars, then I think you will come out a lot more beautiful than when you came in.
Well, as much as we would like to continue discussing, we have to end this program. May we request our viewers to thank our guest today and listen to his advice as we consider cosmetic surgery and reconstructive surgery.
Ladies and gentlemen, let us wholeheartedly thank our guest today, Dr. JJ, for sharing knowledge and information to our viewers about the advantages and disadvantages of cosmetic surgery. I hope our program has instilled in the minds of our viewers some precautionary measures to avoid the risks of having the procedures done on them.
Well said, Dr. Lily. We can go on and on discussing this exciting topic with Dr. JJ, but we've run out of time. I'd like to thank everybody who's been here. Thank you, Dr. JJ.
Thank you, Dr. Lily.
And thank you for being part of this episode, Kalusugan ay Karapatan.